Hello, and welcome to our webinar, How to Modernize Healthcare and Create a Win-Win for Patients, Clinicians, and Payers. This is our Innovaccer webinar, and it is episode 4 in a series of 4 webinars we have been doing this year. We'll be taking questions after the presentation, so please check your chat box and enter questions, and you can do that as we go along into the webinar, so you don't have to wait until again. And let me move ahead and we'll just introduce you to our panelists. We have a great group today. So first we have Dr. Paul Grundy. Paul has been involved with us through the first several webinars. Paul is known as the Godfather of the patient-centered medical home movement and is a member of the Institute of Medicine. Formerly Chief Medical Officer for IBM's Healthcare and Life Science Division, we've been very pleased to have Dr. Grundy join us as the Distinguished Healthcare Leader with Innovaccer as part of our Strategic Advisory Board. And he is also the Global Director of Healthcare Transformation with Health Teamworks. Also, I'm very pleased to introduce for this 4th in our series of webinars, an award-winning technology executive, Phil Fasano. So Phil was the Executive Vice President and Chief Information Officer at American International Group, or AIG. Formerly, he served as Executive Vice President and CIO for Kaiser Permanente. In addition, Mr. Fasano has earned lots of awards and has served IT leadership roles at Capital One Financial, JP Morgan, Deutsche Financial Services, all marquee names, one of the leading CIOs in our industry. Very pleased to have you here, Phil, as you walk us through this concept of becoming a modern healthcare organization. So thanks for joining us. And then lastly, myself, Chief Medical Officer of Innovaccer, and I'll be moderating this esteemed panel. So Dr. Grundy, so moving along, we'd like to do a brief recap of our first 3 episodes. First, we talked about how to empower primary care physicians and teams at the point of care. Point of care being very important. People don't want to go out of their workflow. Second, we talked about the key drivers in building a world-class patient-centered healthcare practice. In the new ecosystem of value-based healthcare, everything needs to be patient-centered. And then in our third, where we had Dr. David Nace, who's also on our Strategic Advisory Board, founding Dean of the Jefferson College of Population Health, the country's first College of Population Health, we talked about using teams to drive value because team-based care is essential in a value-based world as we move into thinking about population health. So, brief recap of episode 1, we talked about building and maintaining trust, having access to real-time information, having access to real-time information from multiple different sources, prescriptions, multiple EMRs, hospital feeds, and then bringing all that data together to create actionable analytics and provide insights, not data, insights at the point of care while the physician or the care coordinator or the patient is in their normal activity and providing those insights with action steps as to what to do. Dr. Grundy, you were with us for episode 2 as well. Tell us kind of patient-centered experience. A lot of what we've learned from other industries, you really need to ask the patients what's working, what's not working, what are the barriers to their care. And that's essential in building trust with the patient. Having access to a complete access patient record and real-time actionable insights at the point of care really helps to drive insights when it's in the patient's point of care, right? When they're using their mobile phone or if they're at their laptop or if they're opening mail, whatever the method of contacting them, that's critical. And Dr. Grundy, it sounds like you're back online, correct?
With trust, with access to data to proactively manage a population from moving from delivering an episode of care to proactively managing a population.
Great, thank you. And then in episode 3 with Dr. Nace, as well as Dr. Grundy, who has seen this through with us through the whole way, we talked about using teams to drive value and really understanding how the teams need to be orchestrated, kind of like a healthcare ecosystem, all singing off the same hymnal, all operating on the same data platform, which is being operating in real time each receiving insights when it makes sense in terms of actions that they can take to take the best care of the patient and the best care of the population. And that is the way you optimize a care team, through this orchestration of all of the different players in the healthcare ecosystem. So with that, that brings us to episode 4. So how to modernize primary care practices. How to modernize primary care practices is the foundation of a new healthcare system, what we call a value-based system, or a healthcare population health approach, and create a win-win for providers, payers, and patients. And modern often means technology. So Phil, I think you're going to be very helpful in this one. So let's go to you. There's been several episodes of trying to digitalize healthcare, right? Because it was the last bastion of holding out with lots of paper files, paper transmissions. What have been the sort of episodes that we've seen, the steps along the way in trying to digitalize healthcare? Phil, lead us into that history.
Hi, David, and I hope you can hear me pretty well. What I suggest here is I think back at each of these waves. I think at the moment in history that we were doing a good bit of this work, a lot of us looked at putting in an EHR in the first wave, which allowed us to get a good bit of information about the patient stored electronically and then available to everyone who was treating that patient as a very important and fundamental foundational step. At the time, I think most of us thought that was it. Okay, we're going to do this great thing called put a medical record or an EHR in place and limit the amount of paper bouncing around most of our health systems. And of course, it's all just ubiquitously accessible and easy to get to. The reality that hit us after doing that work was that that was an insufficient body of work, although a fundamentally important one. Starting to connect the different pieces of healthcare, and the phrase that we started using when I was at Kaiser is to get to all the information about all the patients all the time. Required us really to think about how we connected every interaction they had with any part of the health system, so that everyone who was treating that patient could see all the information about them and what had happened in their last encounter and what they were being treated for and how those things related to each other. And again, we realized as we went through that body of work, important, really was game changing in many respects to us helping patients be healthier, but again, somewhat insufficient and unsatisfying, because what we really needed was the information to offer insights to us. And getting to those insights is actually a part of the third wave, and in fact, a part of why you at Innovaccer have created the systems you have and the connectivity you have, which fundamentally solves that problem, always having all the information about all the patients all the time, and having the insights necessary to help improve their care and improve their health.
I mean, I'm really optimistic that for the first time, we're going to really be able to do for the doctors' minds with information what we've been able to do for their vision with imaging. We're going to be able to make it clear what's going on, in the relationship of proactively managing a population. Really being able to, with artificial intelligence, with being able to get at data in a powerful way, to be able to do the sorts of things that Google Maps and others have been able to do, to put at the point of care the information that you need at that period of time, but also to make available to the system the information you need for the patients who aren't at the point of care. So I'm really excited that we're moving finally into an era where information will really help us deliver care. I think fundamentally that the physician should do two things at a time: difficult diagnostic dilemmas and relationships. And with a team doing everything else, having the data in which you're all singing from the same sheet of music is going to profoundly change how we deliver care. I think you would probably agree with that, right, Phil?
Yes, I would, and I don't know where I cut off and where you picked up, Paul, but thank you for doing that. And once you have the data together, obviously being able to have analytics and AI, I always used to think of it as looking over the shoulder of the physician, providing suggestions and advanced perspectives, as well as, when you think about the patient, having insights come to the patient for the 98% of their life that they're not sitting in front of a physician, to help them stay on course, not only with their current treatment, but across their entire life, what they're eating, how they're where they're living, the exercise they're getting or not, and so many other factors that improve people's health that come through with having all the data powered by superior analytics and AI, and then the toolkit around it to get that insight to either the clinician or the patient at the appropriate time. So we're really at a point in history where, as much as we feel we've conquered, the real opportunity is ahead of us.
Well, this is a great dialogue. I mean, just unbelievable. Let's go back and let's start talking about each wave and kind of what we learned and where we are along the way. So, many of us think back to the high tech back in 10, 12 years ago, 1999, as spurring the first wave of digitalization, right? Because the country was in recession, we needed to stimulate something, so we decided to finally move healthcare into the digital era. But in essence, we ended up creating just systems of record or paper versions of what we were doing in paper. Phil, what's your perspective on this, and what was your experience with that first wave?
What healthcare was doing for a while, and had the pleasure of watching that and witnessing it. When I joined Kaiser, it was just after Kaiser had a failed EMR implementation, and we're on the path to implement their next medical record system, and we're struggling. And they were struggling because it just isn't easy work to do, frankly. And I don't think anyone would say this is easy work to do. But the goals were pretty robust, obviously, to get the systems implemented both in inpatient and in all of our outpatient facilities, to have the data cut across all medical encounters. And then there was this extra one that my boss put on the table, which was to eliminate paper in our hospitals. And in many respects, this wave of technology enabled a good bit of that. Although it didn't eliminate all the paper, although it didn't eliminate all the paper lists that nurses tended to walk around the hospitals with to keep track of their patients and what they were doing with rounds, it did give us a great start. There was a lot of hope at this point that we were really solving the most significant part of the challenge ahead. And I think those of us that went through the implementations, as significant as they were, the realization was pretty rapid that this was a great first step. And we needed to connect so many other disparate systems to the EHR to flow data between those other systems and the EHR, so that the completeness of the picture was created for everyone treating each patient. But this work was substantial. I mean, in my prior employer, it was, for us, it was a $4 billion initiative, which was pretty public. And for everyone, it's the most significant purchase they ever make in terms of technology in a hospital or other. And it's comparable in many respects to buying all the equipment in the hospital when you finally get all the work done on your EHR. And then everyone's tired and wants to take a pause, but the opportunities are so significant post that everyone gets pretty energized by the possibilities that they have in front of them.
No, that makes
for me, the experience was pretty significant.
No, that makes a lot of sense. And you were in a very unique, environment in Kaiser where everything is able to be connected and able to make those kind of decisions. But in the real world, outside of Kaiser and some of the other integrated systems, there has been an explosion of even a greater myriad of not only EHRs, but other data silos. But let's focus on that stimulus plan. Paul, you were there as well at IBM, and you saw the explosion outside of organized system like Kaiser of all these different EHRs in the market as we saw adoption. What was your view of how that has ended up?
Well, my view is that paper, but it's been a very frustrating journey. And I think a lot of that is because, we've begun to put more of the responsibility on the clinicians, to do much of the paperwork in addition to the clinical aspect of it. I mean, I think that we've made a lot of progress, but we sure have a long ways to go. And I'm really excited that tools like Innovaccer, which are now rated in the top 2 in class, are coming along. I think it's going to be much easier with the right tools.
No, that's awesome. All of this has been also talked about as having unintended consequences, right? So now we all go to the doctor. They all have this digital system of record, the EHR. Phil, what have been some of the unintended consequences that you've seen?
Well, I actually, as we were implementing the medical record and watching the behavior of our doctors and the change challenge that it presented to us, I mean, I had doctors come up to me and say my career is over, simply because they just felt personally they couldn't make this transition. And we certainly were empathetic to them and did everything we can or could to make that not so. And in fact, in almost every case, we were able to save the doctor's career from that perspective by helping them with certain peers, helping them learn how to use an EHR and get value from it, and do things as difficult as typing information in for many of them was a challenge. But the biggest challenge often was the physical exam room and where these pieces of equipment like the PCs had to sit. The doctors just hated having their backs to the patients. At Kaiser, we had an engineering facility and we redesigned our clinics, quite a number of them, so that we could put either on wheels or move the location of the PCs so the doctors could be facing patients while they were entering notes and continue in a conversational manner describing what they're doing, which they felt in many respects helped them be closer to their patients, even though the medical record continued to be a real challenge for almost all of them from a time perspective, and the fact that they felt it created a lot more work. I used to hear a lot of stories about doctors working extended days into the weekends, just making sure that their information in their patient records were entered correctly and completely. And they felt that was an extreme burden, and many still do, quite frankly. The engineering of the importance of having the information obviously overwhelms the time, but the real challenge now is for us to engineer these things in a way that make them easy for physicians and nurses and others to use them by getting information into them, and use the insights that come from them in a much easier way than they ever could before. I knew when I was doing this early days that had to be our goal, and changing the way everyone worked had to be part of our consideration.
No, that makes a lot of sense. And, I like this quote from Atul Gawande's recent article in the New Yorker about how the insidious ways that the EMR software began to change the way people began to work together. And in fact, it created them to work less together and become more disconnected. A completely unintended consequence. Well, let's take our first poll. Let's pull the poll up and ask the audience, kind of as they think about moving into this new world of value-based care and risk-based programs, what tools are they using to move into the future now that we have this digital system of record? While we're doing the poll, let's get the poll up. Paul, do you want to say a few comments about Atul Gawande's article and kind of what you learned from that? And in the meantime, attendees
Yeah, thank you, David. So Atul is a very, very smart, intelligent guy. And I've had a chance to interact with him quite a bit over my career in the last few years. I mean, he really did a deep study on the pluses and minuses of EMRs and the fact that I guess I think about this in a very different way. It's sort of like asking a bunch of folks that were delivering goods in 1900, getting together and discussing whether they're going to reshoe their horse Daisy. And it wasn't so obvious that reshoeing the horse Daisy in the era where the horseless vehicle was built in somebody's backyard. I think that's kind of how EMR has come along. But I saw in the article a degree of optimism that progress is being made, and I feel that as well.
Awesome. And let's do a quick check. We're doing another, everybody make sure you get your votes in, put your selection here, and we'll get this in. We're about 50% of the way there. Yeah, it's kind of concerning. I know my father often told me stories about how he began to think his doctor didn't like him anymore because his back was always turned to him. And I would ask my father, why is that? And he said, well, he's busy typing into a machine. So, as an older American, really frustrated with what healthcare is becoming, and he thought it was just his doctor didn't like him anymore. So I think we're getting to a good response. Let's close the poll, take a look at what the poll results are. So we see using their EHRs for pop health and value-based care. Others are using a whole variety of tools. I wonder what the implications of that are. And very few are using a comprehensive tech solution. Phil, what do you think about this approach of using multiple different applications to manage your care?
I think it was inevitable given the tool sets that are out there today. EHRs were really intended to both collect information and insights, but also to get billing done. An EHR plus other tools, and the plus that you have on your poll, makes perfect sense given what was available and what the need is. Being able to pull together analytics and then focus on how you engage patients when they're not in your office and doing those types of things really do transform health. And I'm going beyond care in this instance because intentionally, because they do. And the facts are that we learned this at Kaiser. At the time, we actually had to build many of these things. We had to do our own analytics. We had to do our own patient engagement tools. We were integrating all of the other systems that were not the EMR with the EMR to enable us to really provide the kind of insights to our clinicians and our patients that changed behavior enough to change outcomes. And we then did the analytics around measuring that around broad-based populations and determined that there was a lot of truth, not only truth in it, but there was so much in it that we should just do more of it. So given the history, I would say that this is no surprise at all.
Very interesting. So I think what I hear on the road is lots of data silos coming from all these different tools, not always working together along with all these EHRs. So let's move on. Very interesting results. So I think the second wave was, geez, we have all these EMRs and now we have all these other applications. How do we think about creating this concept of interoperability? How do we get things to work together and sing off that same hymnal? Phil, just very briefly, what do most people struggle with when it comes to interoperability?
Well, connecting the data and getting all the data together is usually a huge mountain to climb. Every system has different standards and often have different identifiers for patients, system to system. Even within common organizations, the challenge is how do I get my patient identifiers unified so that I can then bring data together and then only then do analysis. When you get outside a single organization and you start to try and do what's been known as interoperability, the challenge even gets more significant. I used to call it connected care. For me, it was both inside of Kaiser and, as much as we were a system, you couldn't stop our patients from traveling and, getting injured on the ski slopes or going to Hawaii or traveling around different places, and get outside of our system for care. And for us, we wanted to ensure interoperability to bring that information back so that we had a complete picture of our patients. And that was always the most significant struggle, getting information back together, but also is this really our patient? You know, the medical record indicator for patient A isn't the one we had. It's another systems, and trying to ensure that, you know, we have enough points of identification to be confident that the data we're putting back in your health record, for instance, David, is actually yours. And then we want to, on top of that, do the analysis we usually do. So very, very difficult work.
So that makes a lot of sense. And it certainly sounds like having all of these systems needs to be interoperable, means to be connected in real time in order to take care of patients. You know, Paul, you often talk about how team-based care requires information sharing amongst stakeholders in real time. And with all these EMRs and other applications now being used for value-based contracts, information sharing sure seems to be extremely important and perhaps challenging. Can you share some experiences from your point of view about, you know, where data needs to be accessed by multiple providers and where there's been challenges or success?
So at IBM, to try to get better care for our employees, we really began to ask ourselves, where in the system does the system need to be to proactively manage a population? We thought of that as really a role of primary care, moving towards a system integrator, i.e. moving from delivering an episode of care to being responsible for proactively managing a population. And within that, we began to look at accountable care, i.e. How do you move towards a world of accountability, which is being required now of most providers? What you really need is a source of truth. You need a foundation where you really have data that's reliable, you can get at, and you know is true. And then from that data, you need to understand what's happening with every member of your population, down to the individual level with a plan. The next thing you really need to understand is how you coordinate that, followed by, you know, what is the performance like at the individual patient level, over to what is the total cost like. I mean, those are the elements you're really going to have within your data analytics to be able to move towards accountability or value.
Well, it certainly sounds like having all this data together in one place and working is not just getting the doctors connected, but getting all kinds of things connected, analytics, patient experience, etc. Let's use this opportunity to take another poll. Let's pull the poll up and start it. And I think all of our audience has kind of gotten the hang of how to answer these polls. So what is your current approach for bringing your data together in one place? Couple choices. Your EHR vendor, is it bringing all your data together in one place? Perhaps not, given the last result. Are you building a data warehouse? Are you creating data marts for different stakeholders? Or are you using a cloud-based solution that might be able to be scalable and bring data in from multiple sources? Or most importantly, are you really just not doing this and all your patient data is just not in one place? So given the importance of getting all your data in one place, seems pretty important to kind of get our arms around this. So, Paul, you know, you've been out there. What's been your tempo of you're taking the poll, right? Are you seeing people having their data together in one place, or are you seeing some challenges? And if so, what are they?
It's amazingly variable. I think that what I see happening, have experienced across the United States anyway, is that the work of getting at that EMR has been so intense that oftentimes systems and doctors spend a few years sorting that out, with a perception oftentimes that EMR is going to give them those solutions that they need, but it doesn't at the end of the day. And so, I mean, some folks have done pretty well and really get at the data, but I think it's a deep work in progress. I think they also need better solutions, David.
No, that makes a lot of sense. So let's take a look. You know, here comes the poll results. Poll is closed. And well, 30% of people agree with what you just said, that you know, they need a new solution. They don't really have anything. 21% cloud-based. Looks like the majority are still using data warehouses. and a few are relying on their EHR vendor. Phil, what are some of the limitations of the data warehouse compared to newer cloud-based technologies?
Well, you can actually put a data warehouse in the cloud, but so I'll say that, but so that no one thinks that I haven't thought about it. But the reality is, if you're solving this in a data warehouse, the effort involved in making sure that you're bringing data from all your sources into that data warehouse, cleaning the data, ensuring it's accurate, ensuring that it actually is collected on behalf of each of the patients you want to analyze. And then to Paul's point, when you want to start doing population health management, and you start looking at populations across the data, the amount of work you're doing with present day tools is just an astronomical amount of work for very little gain. You can get some insights, you can get to, a lot of people are doing really amazing things with warehouses, but it's still an extremely painful process to bring all the data about all the patients together. And then on top of that, have the type of quants and analytics people and informatics people who can really transform that data into insight. Having a modern day toolkit to do that for us, to me, seems like that's the easy button and the right path for the future of healthcare. I don't know that we're all getting there yet. I give you guys a lot of credit because I think you've built many of the tools that I was envisioning years ago should be available to me off the shelf and just weren't. And I think there's a good case to be made for what you're doing and how you're doing it.
Well, I appreciate the comments, Phil, and thank you very much, particularly from yourself. There have been many others that have been trying to work at this, right? Trying to get data to communicate, people to work together, HIEs, point-to-point interface, FHIR, and APIs, particularly FHIR APIs are often touted as the new solution. And then there's been organizations that have been trying to create memberships to bring the information together across networks. Limitations, Phil, and advantages of other approaches?
Well, we all try to make the best of what we have, and that's just the nature of, solving problems like this, knowing that the stakes are so high. The opportunity is such a significant one to transform healthcare, improve quality, provide insights where they're appropriate, enhance patient self-care, and those types of initiatives. The opportunity and the stakes are so high and so important. People will, I'll use a golf analogy, you'll play the ball where it lies. And they're doing the best with what they have. And in many cases, this is a money thing. You can spend what you have and you can't spend any more. So it limits the possibilities of outcomes you can achieve based on, just you own these tools, you're going to use what you have and not buy a new one because we just don't have it in the budget this year. I think there's a lot of opportunity with current technology to start changing that narrative materially. And I'll speak just broadly about cloud and other things that are out there that start to offer that opportunity, but healthcare at large has a long way to go to really take advantage of it. So the old school initiatives work. They don't, they give us some insights. They just don't solve the broader opportunity and the fullness that it needs to be solved, and that we all deserve either as providers or patients to have at our disposal.
No, that makes a lot of sense. And let's try to break that down because, despite huge investments, clinicians still say they don't need the information they need, as you point out. So let's take another quick poll. And actually, hold off on that poll. Let's just go ahead and take another quick poll. If we can pull the poll up and see, the question is, where are you in your value-based contracts today, given the importance of all this interoperability? Select one of these. So are you thinking about it? Not quite started? Many people are doing pilots, like an ACO for a small part of their health system. Are you in pilot mode? Are you actually starting to scale it out across your value-based network or your ACO to where all of your system is, your integrated network is on a successful point, or maybe even all of your health system? Have you rolled it out across the health system and actually not only rolled it out, but achieved financial success, which is the triple aim, as you know, right? Reducing costs, increasing the quality of care, having better patient satisfaction, feeling like you're reaching the people that normally have not been reached out to, that are high cost and struggle with their care? Or are you rolling it out and you're still working toward trying to achieve that financial support? So, I would imagine that people are all over the place on this, but I'm very interested to see on our folks. So let's pull up the poll results and take a look. Here we come. All over the place, as we said. So not started, 20% pilot mode. Oh, lots of people in pilot mode trying to figure out, might this work? Scaling the program out, 24%. So some people are leading along the way. And 18%, these are often called the leaders. They've been doing it for a while, have achieved financial success, and others rolling out and working on that. So, Paul, are you surprised by these results?
I'm not surprised at all. But the fact of the matter is that this change in payment is happening pretty fast. So I'm glad we're finally beginning to get some tools that might make this a bit easier.
Awesome. All right. Well, let's move on to our discussion about this. Phil, we often hear you talking about the vision of real-time connected care. You mentioned connected care earlier. Say a little bit about where you think this might be going.
In a sentence, care should be or should have the opportunity to be connected and real time, especially today. I look back at when, 10 years ago or 11 years ago when iPhones were introduced, all of us were, wow, that's pretty amazing. I can put all this in the palm of my hand. What we didn't realize 10, 11 years ago is it was going to change everyone's perception of what service looks like, what every aspect of their life looks like, and have them question how it's being done and how it's being provided. The working assumption, since I can Google it, whatever it is that everything is available and all insights are freely available and easy to access. So why shouldn't healthcare be as connected as I am in my living room when I'm sitting on my sofa, and have the access to all the information about me? And why shouldn't it be real time? And I was saying this years ago at Kaiser, what we're really creating is real-time healthcare. And I believe as much as we were doing that years ago, we're still doing it in the broader healthcare system. And when we finally get there, insight will be available to everyone equally. And then everyone will have the opportunity to act on that insight for a patient's benefit in the moment of need. And when I think about what that means to each patient, it's transformative. We'll save many more lives. We'll change outcomes from everything from stroke to the common cold to cancer. And that's, for me anyway, the opportunity that's in front of us that I think we have an obligation to start to not only work on, but deliver.
Great, that makes good sense, and thanks for your very kind comments here about the work we're doing here at Innovaccer. We're so proud to have you as one of our advisors, along with the rest of our advisory council. So let's break this out for people. I mentioned earlier that all the members of the healthcare ecosystem need to be orchestrated. So it sounds like we've talked about a couple key things here, right? There are all these systems of records, right? Many different EHRs, lab systems. Now states are requiring you to ping an opiate database, and there's other registries as well, claim systems. Strong interest in socioeconomic information as we look at the social determinants of care, path systems, we can get down a long list, lots of data silos. And yet, in a value-based world, there's all these problems we need to solve, right? How do we find the people that are really at risk today and reach out to them and engage them? How do we know when we're seeing a patient in the doctor's office that there's codes missing that might help us perform better financially and more accurately represent what we're doing? How do we think about closing those gaps and knowing that there's a gap when we're seeing a patient without having to spend more time pecking and choosing around in an EHR? Developing analytics to do specific programs for your diabetic patients, for your congestive heart failure patients, having artificial intelligence and automation help to make care management more efficient, helping them reach out to patients using their mobile phones, using their computers, using their telephone, using the snail mail as needed for those patients, what they prefer. How do you engage physicians in this at the point of care and alleviate the amount of time they're spending in the electronic medical record? We have all these new technologies that we can bring to bear, and healthcare has been slow, but we're rapidly catching up. And so there's, real-time analytics, communication, cloud, robotic, or AI, as I mentioned. So if we can get all this data together in one single data source, a data platform in real time, have it all be interoperable and integrated, we can then start to orchestrate, right? We can create real insights to each member of the care team and each member of the patient and their significant caretakers, and really do that in a delightful way, the way we each like our smartphone, the way we hold on to it, we know it can help us and we trust the data. That's the key to giving insights in a very useful way, like you use Yelp to go look at a restaurant and look at their cost and quality to help each member of the ecosystem make a decision. So let's talk about this need to bring all the data together in real time and in such a rapid way. Phil, do you have any comments about kind of this new way of looking at this?
When you talk about having a unified healthcare data model, as important as that is, it's also important to have this 360-degree view of everyone involved and have access to it in real time. And when I think about this, and I say that phrase, all the data about all the patients all the time, it really comes home in what we're capable of delivering in today's world. And it's fundamental to delivering a new patient experience. You talked about delighting. I used to use the phrase delighting our patients, our members, and our clinicians. And that is a tall order. But having data available in a unified way where now we can actually do easy analytics on it, get to insight much more rapidly, and ultimately, as the last point here says, build a system of intelligence where that intelligence is always available, is what this is all about. And it's fundamental to, in my opinion, the future of the healthcare industry.
Yeah, it's a great paradigm shift from a system of record like an EMR where you're using it to look things up to a system of intelligence that's connecting all the players in the healthcare ecosystem and giving them actionable insights that they can act on and trust when they need to know what to do. So, Paul, in this third wave, this concept of moving it from systems of record to systems of intelligence, what are your thoughts of, what that can open the door for us in a new healthcare system?
Well, for example, being able to get at the 36 or 38 public sources of the social determinants of health, and pulling that in a painless way, so that's available to the system to understand. That alone will just really fundamentally change how we look at care. Great paper written a few months ago in JAMA that demonstrated that those folks that ended up in a hypoglycemic event in the hospital in the Fresno Valley, 78% of them did so the last 3 days of their pay period. They just didn't have enough food. I think that really getting at multiple sources of information, but painlessly putting that in front of the clinician, as I've seen done now in Denmark and we're beginning to work at in England, is really going to change how you deliver care.
No, that makes a lot of sense. And being able to leverage these evolving Internet of Things as we put devices in the home and in the community, and who knows, in cars, and then having shared care plans that all members of the ecosystem to use to manage, track, and monitor the care of patients, and have patients be more empowered to do that themselves and engage other people around them. That sounds like a great new future. And I know one of our advisors, Dr. Steve Klaskow, CEO of Jefferson Health System, has been thinking that way in terms of innovation for a connected health system in the community, particularly now that we know socioeconomic determinants are the big driver in terms of outcomes, right? Not just clinical interventions. So let's move on. And Phil, you've often, sorry about that. We've been thinking about technology and healthcare for a long time. And, we have these big players now that are moving into healthcare or making big moves to get into healthcare. We got Amazon and Google and Microsoft and, lots of these folks that don't come from healthcare, but they're all using these terms. Are we embarking on the Googleization of healthcare?
David, I'd say a couple things here. One is this decade isn't any different than last decade relative to big technology vendors making known that they want to have an impact on the healthcare environment. A decade ago, Microsoft was doing that. IBM certainly was, and many other companies were too. The challenge is not only expressing your interest in doing that, but finding the right healthcare organizations that are just as innovative that you can work with and create real partnerships to deliver great outcomes for patients. And I think in a lot of ways, the Googleization term is a good one, because even in the health systems that are out there or any part of healthcare, access to the new toolkit, and I have to call it a toolkit that includes artificial intelligence and other sensor-based information on patients that we're all starting to wear our devices and track our own health. Bringing that data together and getting insight from it continues to create the same challenge that we're talking about just with medical records. What I used to say at Kaiser is we had about a third of the information that we needed about our patients, even though we had all the medical record information. What people do in their personal lives is as important to their health. And Paul touched on it, that, having insight that people just don't have the money to buy food at the end of the month, having insight about where someone lives, the kind of air they're breathing, all the other things that are determinants of health have to be part of this whole conversation, and inputs to, if you want to call it Googleization, insight-driven care that comes from using now a new modern day toolkit which operates at scale. And every bit of this is starting to come together at a time where I think the most exciting part of the healthcare journey is now this next decade with this new toolkit. And the fact that some of these companies want to bring their expertise to bear, I think it's the more the merrier. I'd welcome them. If I were still at Kaiser, I'd be working with them as actively as I could to get the benefit of their great scale and insight and capabilities on the problems we were trying to solve for our patients.
No, that makes a lot of great sense. And, we as we leverage all these tools at Innovaccer, and that's what's really allowed us to very quickly emerge on the scene in the way we have and scale the way we have, and also get the recognition we are getting from Gartner and KLAS. I go back to that delightful patient experience. One of the things that KLAS recently said about us, that our customers say we have 100% satisfaction in delivering exactly what we say we're going to deliver. You really have to delight people. You can't let them down. So, in your experience at Kaiser, you often talked about the proactive office encounter, right? Being able to do the encounter before they get there, so to speak. Say a few words about that.
When I was there, we built this set of capabilities, and one of our physicians in a single region came up with the idea that, even before a patient walks into the exam room, the clinician, whether it's a physician or any other clinician, should have a checklist available to them to deal with the most critical topics of care for that individual, making this a uniquely individualized conversation based on how their health is doing, reminders about tests and normal courses of activity that have to be done on their behalf, as well as basically sitting down with them and having a coaching session if they're not taking their prescriptions as they should, or are having other difficulties. And we basically were able to form up this insight in advance of every visit for each of our physicians, so that when they're sitting with their patient, they're not asking the patient, please tell me why you're here. They're telling the patient, we see, everything that's going on in your health and in your life. From our perspective, would you like to add to that? And by the way, you really do need to take that prescription you haven't been taking. And it made the conversations much more proactive about each patient in a way that ultimately led to even better outcomes on the scores we were tracking about quality of care and quality of that office encounter with the patient when the patient had the opportunity to provide feedback about it. So it was a very transformative, pretty basic thing to do, but we weren't doing it. And once we started doing it, it really changed the interaction between physician, clinician, and patient to a much more beneficial interaction and positive interaction.
Yep. Sounds like proactive is the name of the game here, and I think technology can help us get there. Dr. Grundy, I'm starting to see a lot of questions come in, so we're going to get to the others right after this slide. But, what does this mean for the future? We're starting to see lots of mergers and acquisitions, probably means more data silos. We're seeing all these tech giants we just mentioned coming in, and new payment methodologies, and CMS trying to drive us quicker down the risk corridor. What does all this mean for us in the 2 years ahead?
Well, hopefully we're really talking about some positive, disruptive innovation that's going to support that concept of doctor-patient relationship in really beginning to move away from paying for just an episode of care to paying for proactively managing a population with the technology and data to do that from. I know that when we pulled together 47 of the Fortune 100 to drive the whole concept of the medical home, that continues on with the example you have here of what Atul Gawande is doing, and what one of our other advisors, Glenn Steele, is doing with the Healthcare Transformation Alliance. I mean, it's really not only government that's beginning to request and assess difference in payment, moving away from fee for service. It's employers as well. But this is not pie in the sky in terms of the information that's going to be available to help this transformation. I mean, I had the opportunity of being with a patient who had a personalized video from their doctor helping them, go through better management of their diabetes. Information with AI, the beginning to look at pattern recognitions in a different way, so that we begin to understand that a woman with 3 kids is easiest approached and most likely to respond on Tuesdays after 8. I mean, it's beginning to get at really powerful information to engage patients that are going to, I think, help us.
That makes good sense. So let's go to the questions. First one, and I think this is pretty paramount, really concerned. This is from one of the audience that says, I'm very concerned about how to manage the provider burnout associated with EHRs and their effects on my doctors. Have you seen anything that has really assisted helping to alleviate that sort of burden for doctors? We can take that from Dr. Grundy.
Moved with AI, I think that we begin to get a data platform or an orchestration engine as a foundation of data that we've never had before. It's going to be much easier to get at and clean and process data. And again, Innovaccer just got ranked in the very top for doing that. On that platform, so that's data first, right? That's thinking about data the way Google does and not the way an app does with say an EMR. And then on top of that, you begin to get the applications that takes that data and manages your population, i.e. knows, what is missing, what gaps of care are there, what the issues are, to be able to help inform case management solution, to be able to better engage and notify patients before their appointment and after their appointment. I mean, there are many more, but I'll stop there, and maybe Phil has some other thoughts on that question.
I think, Paul, I think you answered it well. What I would add to it is I think we're now at a point, finally, where the tools that are available, the artificial intelligence tools like Innovaccer, that we can start to lay on top of medical records can make both entry and access to information substantially easier and more intuitive. The nature of entering, in most of these, and I'll call them legacy medical record systems because they've been around for decades, and the companies that are providing them just continue enhancing them a little bit, but they're still legacy systems. And the way you get at them and enter into them is fundamentally different than most of us want to work today. So it's going to take work from your technology groups pushing these medical record vendors to innovate their usability work and really transform the experience to a beneficial experience for everyone who has to depend on these systems. So it's a combination of factors that have to be deployed here to get this to be, really accessible and maybe even delightful, which is where I think the Innovaccer work goes.
Well, really appreciate that. We recently had a number of our customers tell us that the physician engagement process for us when they're using our tools is saving them 3 or 4 minutes a patient visit. That's phenomenal. So they're kind of thrilled with that. Let's go into another question. Very interesting. However, all this data being constantly transmitted could result in people saying this is overwhelming and maybe too intrusive. For example, wearing an Apple Watch that will tell you the patient's activity, sleep, and I'll add to that, as of December 9th, being able to constantly track an EKG almost on par with a 12-lead EKG. Marrying that data with purchase data from credit cards, what type of foods you eat, attempts to look at socioeconomic drivers. What's going on here? Should we be scared or should we be delighted? Phil, why don't we start with you?
Yeah, can I just talk about that? I'm going to give a different but important analogy. Most people don't realize every time they walk into any shopping store, Macy's or Bloomingdale's or others, the store actually rates you as an individual and as a purchaser. And some of the offers you get are really dependent on how you're rated as a purchaser. So this kind of insight and information is collected on us all the time. And it's become, unfortunately, a part of just living in today's society. I understand the challenge when you throw it into, why is my doctor tracking all this, or why is my doctor getting so invasive about my life? I had to deal with this personally when I was putting in place a lot of the systems at Kaiser, because we had this conversation about our patients, and we actually asked them to opt in, and almost no one opted out, which told us as a leading indicator that they really wanted us to track the information when it meant we could enhance their health. And there was almost an implied promise in the work that we were going to work toward doing things that would benefit them as people, and in fact benefit them and their families so that they lead healthier lives. And that's an implied obligation when you start to do this kind of work, especially when you're asking people to give up privacy. Great
answer. And we're at the top of the hour, so just to summarize, great episode 4. Thank you both for attending and participating, giving us your insights from your deep experiences. And then also I want to thank all the audience for not only attending, answering the polls, being engaged, because that's what we want to do in healthcare, is being engaged, and then also just being able to put in some questions too and get some insights from our esteemed colleagues. So thank you, Paul. Thank you, Phil, attending. Thank you for all the audience. A little bit about Innovaccer. We can reach us through innovaccer.com. As mentioned, recently top rated in class and lots of awards for the type of work we're doing to move into this sort of new world of technology applied to healthcare. So thank you very much, and we'll look forward to seeing you next year with another series of webinars to explore this further. Thanks, everybody. And that concludes our webinar.